Good morning. Thank you so much for attending this session. So my name's Paul Sanford. I'm fortunate enough to work for Nuffield Health, the not-for-profit health and wellbeing provider. My job is really to sort of work with organisations to try and help and sort of, I suppose, really shape their health and wellbeing strategies. You've probably heard my colleague Marcus speaking earlier about the sort of, I suppose, the value of data and how important that is to really form your strategy. I've been doing this for a long time. My background, actually, and don't hold this against me, I'm actually an accountant by trade. So for me, proposing a strategy that makes really good business sense is really important. And it's something I'm actually really passionate about. A lot of the time when we put together these wellbeing strategy, there's always a sort of undertone, a sort of, why should we do this stuff? What is important? But then there's also sometimes a really nice sort of human element to things. Some of the best sort of strategies that I've implemented with businesses have done that financial piece. Yeah, it's reduced absence, it's in some way improved productivity. But then I hear these human stories. It saved someone's life. It helped someone who had a problem with their mental health. It helped someone get back into maybe a more sort of fitness environment and actually do things they hadn't done since they're at university. So I think when you look at what you're actually trying to achieve from your wellbeing strategies, think from a really sort of balanced scorecard approach. You probably will have your CFO going, tell me the real hard line sort of financial results. You may have HR saying, help improve things, help reduce absence. But then you also can look at sort of the more human stories, the employee journey and how things can be improved. So I'm just going to talk a little bit about, I suppose, what's important. I have been told this was a workshop, so what I will be doing is maybe getting a bit more interaction. It'd be interesting to hear your stories and get some sort of live feedback on what you're actually doing. So I suppose the first thing is what is, why is this so important? We spend a lot of time at work, we all know that. We're always working, it's a very, it's what we do. It's pretty much the majority of our life. We're constantly fighting that balance against sort of work-life. So for a lot of businesses, they are concerned. A lot of businesses come to me and say to me, why, what's going to happen in the next 10 years for us? What onus is going to be put onto us as an organisation? It is a challenge. We can see what's going on with public health. We can see the sort of restriction of services, how long it takes someone to get mental health treatment. In some places, it's like 12 weeks, so it's far too long. And also, they're really concerned about, their workforce is changing. There's a lot of different drivers now. There's home workers, there's remote workers, there's people working longer hours, there's global, it's very different now. So all the organisations are looking at what is specific to them and why they would invest in their wellbeing strategy. So I think that's really it. The backdrop is sort of what is coming next and why should I invest now? It's quite interesting because I've seen a lot of businesses sort of sometimes take quite a short-term approach. Why invest in well-being? Well, when they look at their retention rates, when they look at how long people stay with them, they're saying, well, will I actually get some form of return? And I think I always say to people, yes, you will. I've seen that some really good data on sickness absence. I think it's in the last sort of year or someone, when they're thinking about maybe moving on, they're more likely to take more time off. I think it goes up to about 60%. People won't take time off, but as soon as they start to think, actually, I'm going to leave this business doesn't care about me, all of a sudden that shoots up by 60%. So, there is a reason to sort of invest and do it now. I think also, we see it all the time. You see all the stats around sickness absence. It's increasing. It's always going to be there. I think for what businesses can do is look at how they can sort of stem and contain those problems and actually try and think about the sort of prevention and do things up front and not wait for things to happen. In terms of also why is this driving strategy? Well, I think a lot of, you see a lot of press now about this. A lot of big businesses are investing. We constantly have people come towards us, big banks and big professional services companies, and they're saying they're almost competing. They've got this war for talent. They want to attract the right graduates, the right people to them. So at the same time, there's a real need to sort of be showing to the outside world that as an organisation you care about people and you want to do the right things. So I think a combination of trying to address problems but also trying to appear to the masses and attract talent, that you're actually the right business. You have to have a wellbeing strategy. Your people are your most valuable assets and you need to look after them. So I think that need to sort of address the short-term stuff around keeping people here, but then also think about the longer-term piece, what will happen with the NHS, and I suppose to you as an organisation, what onus will they put back on you? With any wellbeing strategy that you develop, it has to sort of immerse itself into the business. It can't be this sort of cold strategy that you just, like a cookie cutter you put into a business. So as part of when I sort of start up my consultancy and I speak to companies, I try and really understand, what is it like to work there? What are the things that you really are passionate about? What are your values? What is your vision? How can they, because most of the time I'll read it on 1,000,001 sort of careers websites. It will say our people are essential to our vision and our goals. So you sort of go, well, if that's right, then you've got to invest in your people. So what we always try and do is make sure that the wellbeing strategy feels very tailored and immersed to the business. So, really look at, what is important, what is the language that resonates with your business. When you look at your culture, and even down to the point of actually inducting people into the business, there's a view you can actually put almost a wellbeing element into your induction. So actually people come in at the start, and as part of, this is what you need to say to the, if you bump into the CEO, really, embrace those values. But if there's some sort of theme that's running through those around well-being, actually what you can do at day one is bring people in with the right sort of mindset. And whether that's setting, the boundaries around sort of work-life or just explaining to them what's actually at their disposal. A lot of businesses have such fantastic sort of health and well-being benefits, but they're poor about communicating them. So actually a really good point is when a new person comes into the business, you can talk to them about that. Especially around mental health and emotional well-being. I think that's a really important stage. When someone comes in, explaining to them, what that could look like for them as a person, how we view work-life, how we view productivity. I always think it's important. I run a team and it's all very about outcomes. So I've sort of changed sort of the clock in, clock out structure of our team and really look at what they're producing. And that's really important to me, actually, to try and get a view from what are you actually bringing to the business and what are you delivering. So I think it's really important, whatever you do around your wellbeing structure, is to align it to your business vision, because your people will help you realise that vision and your goals if they are healthy, productive, actually in work. So again, just nicely match that up. I think I sort of mentioned this briefly, but this is, I think, it's a fundamental part. It's amazing how many businesses I speak to and they go, oh, we don't do enough, we don't do anything. And all of a sudden I just literally start to ask them some leading questions. Well, what have you got? We've got an employee assistance program. Fantastic. That's a really good thing, because ultimately that's available to everyone. It's focused around mental health. So it's a really good thing. Oh, it's poorly utilised. Okay, well, let's do something about that. Let's look at how you can improve the communications. Let's talk to everyone and tell people what it's actually there for. I spent a bit of time in an EAP provider, and the one thing that really amazed me was actually the sort of breadth of services they could offer. Just to say, Nuffield doesn't do EAP, so I'm not selling it for Nuffield. But it's a fantastic service. Actually, when I went and sat into the EAP provider, what I realised is they could help with finding childcare for me, and they could help with sort of property transactions, not as much as a lawyer, but they could advise on things. So actually having that service as a baseline is very good. Look at what else is available. Things like private medical insurance will tend to only be available 5 to 10% of people. But what else are there? Are there cash plans? Are there other offers? What is occupational health doing? It's a bit of a sort of controversial subject sometimes, I think, occupational health. When it's done well, it can work really well. Other times it can doesn't really add value. So sometimes part of this audit should be challenge your provider. Get them all together, get them in a room and talk about how they can help you. And so as part of this piece is really to audit, where are you now? What services do you provide? And what services are you looking to do? That's just from a provision perspective, but then also think about, some of the, I know my colleague Marcus talked a lot about stats and stuff, but if you have data, if absence is at a level which you're not happy with, or engagement is at a level you're not happy with, well then let's look at the sort of building blocks to actually get it where it needs to be. So audit is a key part. Do that first part about what are we offering and how can we make this better. And that can be communication, engagement, integration with your providers, but just try and get everyone around a room and really discuss how they can really help you. So this is always key. I've worked with some great businesses, advocacy, so we all know this works. So if you've got someone at the top who is really championing this, it's really important. If you've got a CEO who's smoking cigars and not interested in the people, just interested in the shareholders, it can get challenging, okay? So it's really nice when I work with businesses where they've got a lot of people on the board, the C-suite, who are actually endorsing the whole wellbeing piece. Some companies are now setting up sort of like, wellbeing directors, wellbeing managers. It's a really positive sign. A lot of the time I take it, the HR colleagues and the health and safety colleagues and employee benefits colleagues will all be sometimes will be given this sort of mantle to run. But it's important that it comes from the top. It's important that the business really does, place a high value on this. Because then if you've got the support from the board, then it works really well. An interesting factor within actually Nuffield Health, so we have 15,000 colleagues that we look after. And we actually do our own internal sort of wellbeing sort of strategy for our own business because we need to sort of walk the talk. And as part of that, our board reports on a monthly basis, what are we doing around wellbeing? What is the success? We have a lot of different things to balance again. So, the financial results, our charitable status, the people agenda is a really important part. So again, when it comes to advocacy, it's that sort of reporting part as well. Having people that believe in what you're doing, but then also how can you show this to the board and everything else of what's really looks like success. So I think having someone who owns wellbeing is important because they will continue to drive this piece forward. Just out of interest, is there anyone in this room who has anyone in their business that is, is in charge of wellbeing? Do you have like a? There we go. So quite a few. It's good to see. So it's a real positive step. So again, having people that are in charge of it, but then also having people from the sort of C-suite who are also, advocating this, recommending this is a really, really positive thing. So then once you've got once you've done your gap analysis, once you've got someone who's owning it, it's really then to sort of look at what is the scope of your wellbeing provision. There's going to be different elements. It depends on the sort of business you are. If you're a manufacturer or a pharmaceuticals sort of provider, it might be a little bit more risk-based. If you're a financial sort of professional house, it might be more about retention and retaining talent and productivity. So really it's look at the scope of the services that are going to be really relevant to your business. So we mentioned the sort of the key ones here. So it's, the physical piece, it's good. We know, everyone knows, I know, because I went for a run this morning. It does change your mindset, it's good. It's that physical piece, get people active, get people moving. The mental piece, well, hey, look, you'll hear a lot about the mental health agenda. It's essential, everyone knows this. You only have to look at the press, the stories. I'm sure a lot of stuff you're already doing with mental health first aiders is essential. Look at the sort of social side, how much are you, looking at your people, how much are they sort of you thinking about what they're doing, for communities, or how much they're doing at home, how much do you place on that? Environmental, things like that, it's important stuff to look at. One thing that is something that I see that's probably linked to a lot of sort of mental health problems at the moment is sort of the financial wellbeing side of things. There's some great sort of financial wellbeing providers out there that give you great advice and help people with their mortgages, their loans, consolidate debts. It's definitely something that I'm probably being asked the most about at the moment. Financial and probably mental health are the sort of the key ones that people keep coming and saying, look, we've done a load of great work around this other stuff, but actually can you help us a little bit more in these areas? Giving people really clear education advice on how to sort those things out is really important. When you talk about health risk management, it's actually having a picture of what it looks like for your business. Do you know how many people are suffering from, high cholesterol, how many people are suffering from bad backs, you know, what is going on? Are people overweight, underweight? You know, what does it look like? So, you know, what you can do, and Nuffield's got a lovely little tool if you need it, is actually do like almost like a diagnostics tool across your business to try and get a picture of where the issues are. Sometimes you may have already done this via surveys, which I know are dirty words, but you know, you might get a feel for what are the things that are going on. But you can also get this data from your occupational health provider, if you've got a health assessment provider, or anything like that, you might get some good outcomes data. So looking at, you know, sometimes the best way to look at things is not just your provider, EAP, OH, or whatever it is, but then take the risk and look at what's going on. So what does mental health look like across your health assessments, your private medical insurance, your EAP? What is the trend that's going on there? What is the trend that's going on around your sort of musculoskeletal problems? So I think having a really clear picture of what are the issues and then how can you actually address those issues is key. CSR, so yeah, absolutely. You know, businesses got to look after people, so it's a key part of well-being. So we just need to ensure that that's addressed and that's fundamental. And I guess that gets tied back into all your values and beliefs. The sort of HR side of things, so, you know, we want, whatever I do, I need to ensure that, you know, this is like an extension of your business. You know, it's a vehicle for change. You know, I work very closely with the HR community, employee benefits, to ensure we get these things right. So what are the issues that HR is facing and how can the wellbeing strategy address that? And again, that can come back to sort of sickness absence and presenteeism and things like that. So again, this is really about what is in scope, what are the things you really need to address. Budget, well, there we go. So look, I know this is a challenge, you know, it's not easy, is it? Budgets, you know, don't get bigger unless you're a business that really has bought into this. It's quite interesting, some of the companies I work with, and I never name names, but you know, I work with some businesses that I would not expect to invest heavily in well-being, and they do, and they continue to look at what else they can do, and they believe it. And then I work with some businesses who I would think would invest more, but don't, you know, and really sort of challenge what they spend. So I think it's good to understand what you have at your disposal. You know, consolidate all the budgets. Probably Marcus might have talked about it, but there is this sort of, you know, theory about saying stop or no, or just having a bit of a step back and see what you're spending and actually challenge it. You know, are you really spending after the right things? If you spend in this area, would it really sort out a problem? You know, my whole sort of belief around this is to change it. You know, budget tends to be, it's a cost in the P&L. It feels very dead. I think the thing for me is to try and change the investment into well-being into an investment and actually drive a return. Again, I speak to businesses and they want that. I was with a big retailer last week and the fundamental part to them was we need to show that actually investing in well-being will save us money. Fine. I was with a sort of financial house last week again, and they were more concerned about value on investment. They want to know about engagement and productivity. So it is interesting, you know, it can be viewed in different ways, but knowing your budget, knowing how to position the investment is key. Sometimes what I do, and maybe it's because I love a spreadsheet and my background, but I actually work with businesses to build up the business case to say, look, you know, we've identified a problem. If we stem this problem and we invest, we will get this back, okay? So that's key, you know, that's what people want to see. Sometimes people say to me, it's really hard to sort of justify investment and, well then I suppose you've got to look at where your data is and sometimes look at what can be measured. You know, is it satisfaction surveys? Is it that you're going to see less referrals into occupational health? What is it? So there's probably something we can measure, but knowing what budget you have is essential. But then challenge your budget. Make sure you're spending it after the right things. Don't be afraid to stop something that you don't think you're getting a return from. I always think this is key. So really, once you've got these key elements, it's really then, you know, I suppose, how do you execute the program? You probably, if you've got someone who's fortunate enough to look after your well-being, you know, where you work, then that's great. They might take ownership of this stuff, but it's really important that once this stuff has been drawn up, it's actually embedded in the right way. So, you know, work around your mobilisation. look at all the key things that are important to you and ensure this is delivered well and on time. I think also you've got to think about the drivers, about what you're going to get out of this. Because we work within different settings, sometimes it's looking at a on-site facility, sometimes it would be a national proposition. So really look at how do you promote that, what is the communication strategy, and then also what are you trying to get out of this. We do a lot of sort of pop-up events, we do a lot of promotion, we do a lot of digital strategies, and sort of doing nudge sort of notifications to tell people what's coming. So again, once you put this in, the best thing you can do is look at how you implement it. How do you communicate it out to your colleagues and your employees and get the best return on this? Some of the organisations we work with, they enter sort of Britain's Healthiest Workplace and all those great sort of recognition tools. So again, are you doing this as well to get recognition for what you're doing? I always say they're having a lot more fun in there. Okay, all right. Apologies, my jokes on a Monday morning aren't great. But again, is that what you want? Do you want like an award in your sort of head office for this sort of stuff? So again, as part of the program development, that's really look at how we do this and how we do it well. So getting it implemented, getting it communicated is key. And I've sort of may have sort of blended these together a bit, but I think brand is a good subject to talk about. Sometimes organisations create their own brand. Has anyone here got like a Wellbeing brand that you sort of, fantastic, look at this. So it's excellent. What's some of the names, just out of interest, of what you call it? Balance, lovely. Fantastic, excellent. Yeah, exactly, really good, excellent. So I think that's it. It's sometimes nice to have something that really resonates with your employees. It feels very ingrained and feels very owned. So having that brand is important. And getting people behind that brand and constantly messaging that brand and talking about it, creating a bit of a buzz around it is really key. So really, then it's about, okay, well, we've got this great brand, we've done this great communication, let's just check it's driving the right things. So having people that are your wellbeing champions, people that keep this going, because like with any strategy, it's great, it's sometimes seen as a 5-year, 10-year horizon, but actually the key part is actually keeping it going, keeping it live, keeping it fresh. I always recommend that it evolves. Anything you do should evolve. Try things, test and learn. Has this worked? Has this not worked? And if you've got people that are driving this from a wellbeing champion perspective or from HR or whoever it is, that's key. So constantly look at what you're doing. Is it driving the right things and the right behaviours? So again, having that, the communication, the brand, will be a great way to keep pushing this forward. So I think the best way when you're doing these sort of longer, wider strategies is to really keep a really good sort of tight project plan. So making sure you know the key milestones and all the key elements that are actually going to be part of this. You don't want to always rush it. It's nice to create a big bang, but then it's also good to keep updating things so it stays, it stays relevant, it stays fresh. So be very clear with your colleagues what they're going to receive, when things will be available. The worst thing I've ever seen is when things are sort of pushed out but then almost not delivered. People become frustrated and they don't actually get what they would expect. So again, have a really good roadmap, have some really good direction and really focus on an implementation that works really well for you, because I think that will then ensure you've got a successful program. I think this is one of the sort of final steps for me really, but I think, we've said this, it is an investment, so continue to look at what the outcomes are. Try and get as much data on this as possible. If you can really establish a really good baseline at the start around absence, spend, whatever it is, and you can actually show over a 6-month, 12-month, 3-year period that this stuff has done the right things, you can be a hero. That's why I always say to a lot of the sort of HR colleagues and people I've worked with, and they're very proud of their achievements. A good example of this, I worked with a big sort of global telecommunications provider, and they had really good data. They actually had excellent data because it was like a call centre environment, and they had about 3,000 people that worked in a call centre. And when we went in, we did say to them, said, well, show us your data, what's going on? Because we were a new provider, we were eager to impress. And when we looked at it, their sickness absence was at 9.5%, so really, really high. And it was quite interesting because the business itself didn't actually know why. They were sort of asking us, well, why is this? Why is it at 9.5? And we had to do some digging. So we looked at the occupational health results and realised that it was a high level of mental health problems. And what had happened for this telecommunications provider is they'd actually changed the commission structure for their employees in the call centre. So what this meant was all of a sudden people couldn't pay their mortgages, they couldn't do a lot of different things. And people weren't turning up for work, people were in panic. And it was quite a scary thing for them. What we did was we then spent a lot of time sort of looking at the targeted interventions. We knew there were certain areas of that business that were suffering. There were certain areas within the contact centre that were suffering. So we started to speak to a lot of the line managers. I think once we did that, we realised actually the line managers are quite junior, so they needed some form of training. So we worked with them and occupational health to sort of advise on what they could do and how they could support their employees. We did a big piece of work around what they actually had on site and what access they had to EAP and other facilities. So we spent a lot of time with them just educating on what actually they could do, building pathways, building interventions. And because they had good data, we could actually track those interventions. And over a 6-month period, their sickness absence went from 9.5% for a 2,000 person call centre down to 3.5%, and then went down further to about 2.5% after that. So, that actually saved them a huge amount of money, well over £1 million. But it was measurable. That was the key thing. So it was really key to have that. So again, going back to some of the information you might have heard in Marcus's presentation, get good data. Really challenge your providers to get that good data, because then you can measure this. Look at the engagement, look at other stuff that's softer, but look at spend levels, absence levels, and then you'll have something really good and compelling to talk about. Once you do have that, then you can have some sort of continual program, I think, that then people will continue to invest in these sort of things.